So I'm going to guide you through the 9 targeting steps that are part of the, as Emmanuel rightly said, the targeting process. So targeting is not one single exercise, but it's a combination of different steps that will guide eventually the targeting process and the targeting system in place. So when we talk about targeting steps, and targeting is not an exercise per se, but it's really embedded in the program and or operation management cycle. So when we refer to the targeting steps, we need to have in mind really the program cycle that often starts with an assessment to understand the need and the vulnerabilities of the population. And we have here the 2 targeting steps on the registration and analysis. Then we, based on the results of the assessment, we will have the program design. And also there are 4 steps the 4 steps related with these specific with the specific program design related to targeting. Then we have the program implementation, and we have 2 steps that are related with targeting, and then the monitoring. We are going to go over these 9 steps, specific steps for targeting. Sorry. And we are going to go, step by step to just, address which are the contents of each steps and which are the considerations that are needed for each steps. Because we are talking about refugees and these joint guidance are referring to the collaboration between UNHCR and WFP. Often the example in this presentation are related with refugees, but say that these are pretty much generic steps that can be adopted in any operation, but in this case is referring only to WFP. As I say, I'm going to go step by step, but in the guidance, all the steps are very detailed and have specific examples, so I really invite you after this presentation to go through the guidance to have all the details that are needed. And on top of that, we are planning also other webinars that are really focusing on specific step of the targeting related with the selection of the methods or the analysis, and also a webinar is coming soon on the registration. So let's start with the first step. When we talk about targeting, that is the registration. So what is the registration data is key, and it's a key source of to understand the population of concern. As mentioned before, the registration is a process of recording, verifying, and updating information of a defined population to register them for assistance or for protection concerns or for any other purposes. So when we talk about registration of refugees and in collaboration with UNHCR, we often refer to the Progress. Progress is the case management system of UNHCR that records, updates the person of concerns, and contains all the information about the operation of the beneficiaries of the operation of UNHCR. Progress has specific data fields that are mandatory for all the operation, but other data fields can be enlarged based on the context or specific country context. For example, it's managed at country office level, so apart from some mandatory fields, can contain other fields that are specific for that, the refugees or displaced population in that specific country office. The registration database is updated on a regular basis, and there are 2 ways that it can be updated. One on ongoing registration, but also with ad hoc verification exercise. So why it's important that the registration data for targeting? It is important for two main reasons. One, with the registration data, we know all the population that we are referring to. We have the socio-demographic characteristic of the population. We know the protection issue, and we have an idea of the population that we're talking about. So you can use, with some limitation, but can be used also to sample the population for an assessment, but also can be used to have some statistic about the population. So how many, for example, refugees have, female-headed households, or for example, how many refugees have, a high dependency in the household. So these are all statistics that can support the analysis of the population. But also it's very important to identify the cases that are eligible for assistance. For example, once the eligibility criteria are defined, this can be applied to the registration data sets and come out with the list of beneficiaries or targeted population. So how the sharing of information is managed is through a data sharing agreement that has been developed in 2018, and this provides a framework for local data sharing agreements based on the needs of the specific operation. So in the data sharing agreement, in the Annex 3, basically there is explained how the data are shared among UNHCR-WFP and partners and the use of the data. But for this, there will be a webinar on the 17th of December that really focus on the progress on the registration case management of UNHCR, and gives you all the detail of what's inside progress itself. So the second step for the targeting is targeting process is the assessment and analysis. We all know that good targeting really depends on robust needs assessment, data and analysis. And why it's so important? First, to identify the number of people in need through an assessment that represents, the population of concern. We are able to identify how many people are in need, how many are vulnerable, and based on this also to understand their characteristics, their vulnerability, and try to profile the most in need. The profile exercise is very important and can be done through the assessment, especially when we need to understand the key characteristics of the most vulnerable population in order to define and inform eligibility criteria. The third objective of the assessment and the analysis is to inform the response option, the targeting decisions, and the kind of implementation approaches that are needed. So usually the assessment should be done in collaboration with among the agency, in this case UNHCR-WFP, but not limited to that, also with the government, with local authorities, with NGO and all the stakeholders that are involved in that specific context. And because the needs are different, I think the idea is really in the past years is to conduct more multi-sectoral assessment in order to enable the identification of different needs. And assessment can be qualitative, through having really tried to understand key aspects that are not easily available through data, and this can happen through focus group discussion or key informal interview, but also quantitative. So the assessment with a representative sample that is able to give us the percentage of the prevalence of the specific outcomes. The third step, for targeting, and this is very much related with program design, is to understand and decide whether the targeting is appropriate. So targeting is not appropriate in all contexts. We can have the case after our analysis that In certain settings, the cost of need-based targeting may be higher than providing assistance at all. So there are several considerations that we should take and should analyze when deciding if the targeting is appropriate for that context. First one is like the political and legal environment of the refugees. For example, we need to understand if there is the freedom of movement, if there are livelihood opportunities for the refugees, and which is like the legal environment around this. We also need to understand if there is physical access of the people of concern. We need to understand if we are able to access to the targeting, if not, maybe targeting is not really a good option. We also need to understand the social cohesion among the refugees in this case and the host community to understand if the targeting is inappropriate, that won't, create an environment that is hostile towards the refugees and the host community. And also we need, as Charlotte and Anika were saying, the protection risks that have to be considered and that to be understand which are the risks that might occur if we implement a specific targeting. Last point to consider when we develop a targeting is really needed on the capacity and available resources to conduct the exercise. Capacity in terms of staff, in terms of ability to conduct assessment, analyze data, but also resources in terms of monetary resources and budget available to conduct this. One example in the past where really the operation understand that targeting was not appropriate for that case was the example of the Kakuma camp in Kenya. So in Kakuma is a camp that hosts around 182,000 refugees, and it was established in 1991. So in 2017, the operation has decided to have an assessment to understand the percentage of people that were able to meet basic needs without support. So as a result of the assessment, only 4% of the refugees in the camp were able to meet the basic needs without any support. So considering this low percentage and considering also different targeting methods and the errors of inclusion and exclusion to identify this 4%, and also the cost, that identify this 4% was more costly than have blanket assistance, the operation decided not to go ahead and conduct and implement a targeting that in that case, for that specific period and in that context, was better to continue with blanket assistance instead of moving towards targeting. Another thing that we should consider, another step that we should consider is that we have different targeting methods. So when we select the targeting method, we need to, have in mind that no targeting method is perfect. Each method has limitation, pros and cons, and this needs to be evaluated, for each of them based on the context where we are. So sometimes to mitigate the limitation of each targeting method, a combination of approaches usually is the most appropriate and effective way to do this, to reduce error. And so we're going to see now a few methods that are used, and I think that based on the Mentimeter response, we had different methods were used in the operation where the audience is from. So geographical targeting is pretty straightforward. So we target a geographical area that we think it's most in need. So it can be a camp, but it can also be a region or an area hit by a specific natural hazard or a crisis. So we don't target a specific household, but all the population living in a specific area. Community-based.
Cinzia, so, maybe just a question that came up on deciding whether targeting is appropriate or not. There was a question on if targeting is not appropriate, does that mean that we would provide blanket assistance?
That's a good question. I mean, yes, I would say yes, you know, for the time being, in the sense that, you know, the targeting can become appropriate also in different timings. So I think that this evaluation should be done, you know, based also on the resource of the operation. But, you know, in the case of Kakuma, you know, they continued with the blanket assistance. Then there is, if the resources are not there, I think we need to also consider the fact that a prioritization instead of targeting could be an option. I mean, if the resources are not there. But if targeting is not, you know, appropriate in that context, that specific group, you know, blanket assistance should be the option.
Great, thank you.
So we were at community-based targeting. So during these methods, we have the leaders of the communities and the community itself that will validate which are the eligibility criteria for the targeting, not for only validate, but also define those criteria. And this works well when we have communities that are very cohesive and know very well the situation, usually smaller community. We can have also self-targeting when a household or an individual define itself in needs and apply for a specific program or for a specific intervention. Then we have other three different targeted methods that are more related with data and assessments. The first one is categorical targeting. So it can be at individual level or at household level, and is when, you know, we have easily and observable characteristic of the population that are identified as categories. So all the individual or household with those characteristics are targeted. And these are often related with socio-demographic indicators that are often present in the progress data sets. While the difference between the categorical targeting and the scorecard is like with the scorecard, for each case, you have a specific indicator with some weights, and we have a scorecard, and the household or the cases are ranked based on their vulnerability. So everybody has a score, and usually this is coming from census or information that you have collected for the entire population. So it can be very pretty, you know, expensive and time consuming. The proximing test is when, through an assessment, you try to extrapolate using statistical model specific outcome indicators for the entire population. And also this one, you will have you know, a ranking of the your population are based not on data that you have collected, but also based on the statistical model that you have implemented, and then based on threshold you define your population in need. So I said before, all these different methods have pros and cons, and there are specific requirements for each method. In the guidelines we have explained this very well, but there's going to be another webinar that only looks at the specific method, which are the pros and cons, and which method should be, you know, used in different contexts. As I said before, you know, often the combination of methods, it's a good solution to try to mitigate the limitation of each method and to reduce errors. So in case of Cameroon, and we're working at this at the moment, the example of the current targeting for car refugees, it's a combination of three different methods and different elements from each method to try to come up with the targeting strategies. So there is the geographical component that is pretty much linked where the car refugees are currently residing in Cameroon. We have a categorical component that identifies eligibility criteria based on the need assessment and the identification of the most in needs. And we have also the involvement of the community in defining these criteria through consultation, but also in verifying the final criteria, eligibility criteria coming from the targeting. Of this. So, which are the factors that we should consider when we, when we decide which targeting method we should use? There are 11 factors. I'm not going to list them all, but they can broader be regrouped in 4 categories. Again, in the guidelines, they are pretty much detailed and examples are provided for each of the factors. So the first factor that we should, take into consideration when choosing the targeting methods is the risks and security. So will this method put certain targeting individuals at risk? Or which are the political and the security concerns that restrict the mobility and then will, facilitate or not the implementation of a targeting strategy? And which of these risks or security will affect the implementation of the targeting per se? We also have, a factor to consider is rate with resources. How much resources do we have to implement the targeting, or to conduct an assessment, or to have an analysis, a specific analysis based on the resources? We select one method instead of the other. But also, consideration should be taken around accountability. So, how consistently can these methods be applied, but also how easy it is to explain this specific method or approach to the community. Some community explaining approximate testing is very difficult. Therefore, if there is the need of the involvement of the community and be part of the selection of the eligibility criteria, maybe we choose a method that is less has less technicalities and is based less on statistics and more, for example, on the understanding of the vulnerability by the community. Another important factor to consider, the community engagement. So as we saw before, community engagement is really key. Especially because we need to have the buy-in of the communities, and so how are the community going to be engaged in specific targeting methods, and is the community cohesive, and how we are making sure that with the involvement of the community we include the invisible groups inside the targeting. So there are all several considerations that we need to explore when we decide in the methodology. On step 5, we have the definition of the eligibility criteria. As said before, the eligibility criteria has to be context specific, and they represent the common characteristic of those in need to determine where the individual or a household will be targeted to receive assistance. They should be feasible to implement and updated on a regular basis. Again, here there are 11 principles that are guiding us to the definition of the eligibility criteria, but the most important here are, first of all, to ensure the community participation in the definition and the validation of the eligibility criteria. The eligibility criteria should be protection sensitive, as colleagues before have mentioned, and definitely they need to be associated with outcome indicators that define, the people in need, indicator related with food security, food access, economic vulnerability, etc. When possible, the principle should be aligned with existing criteria. We have certain specific context where there is already a social safety net in place, and therefore it's very important that the targeting criteria for the for example, refugees are in line with the one with the host population. We said before that none of the targeting methods are perfect, so we need to validate the methods and the criteria every time that we design a targeting approach. So we have, why we are doing this, the objective, we need to first of all estimate the errors. As we say, we need to estimate the inclusion and the exclusion error. And this can be estimated in the design phase, so when we are drafting the targeting approach, but also in the implementation phase. So when we are roll out of the targeting, we should go and check again the inclusion and exclusion errors through verification exercise, for example. We need also to compare the effectiveness of different methods. So we need to put on the table and analyze different methods and which are, more effective than others. And also we need to assess the appropriateness of that method in relation with the context, but also with the community. So would the community accept that specific targeting method, or that specific targeting method will have an impact, negative impact to the community? And then, the validation of the targeting methods and criteria is also very important to inform the program, because the program needs to be ready to set up mitigation measure, referral mechanism to make sure that people can really appeal back and be included if wrongly excluded. Again, the validation can be qualitative and quantitative, can have qualitative and quantitative components, and the validation is not done, once, but is a continued exercise that has to be repeated on regular basis. So we have talked about the targeting step in the assessment, in the program design. Now we're referring to the targeting steps during the implementation. So, Emmanuel, I think you have switched off the PowerPoint. As I said before, the involvement of the community is key during the definition of the targeting approach, and timely communication around targeting is really essential. We have several communication channels that can be used. Example could be community consultation, but also social media, hotlines. Really depends on what is more suitable for the context. We need to have an appeal mechanism in place. So, refugees or, households that are not targeted can be requested to be included in the assistance. And as Anita said before, we need to have a complaint and feedback mechanism strong that is in place to understand and analyze the implementation of the targeting. First, to understand the informal structural issue that the targeting approach can have, but also this can be, the communication can be also a good step to request, refugees to update the registration data based on which they will be included in the targeting. So when we talk about implementation, step 8 is the implementation and the identification of the refugees to be targeted. So the criteria can be either applied up to date on a registration data set. So I say, if I use the progress data and say, okay, in these dates I will try to roll out my eligibility list based on the criteria that I have defined, or if they are based on community approach through the selection of the eligible population through the committees. There are specific steps that are required, especially if we are using progress data sets. I think I'm not going over this now, but again, in the guidelines, there are really detailed example of how use progress data and eligibility criteria to derive the list of eligible population or the target population. So the last steps is really necessary to understand if what we have built so far and if the targeting approach that we are implementing is really working. So we need to monitor. It will be good if we can monitor it jointly, if the targeting has been developed jointly, so we are all aware of the strength and the limitation of the methods. But we need to monitor outcome indicators of assisted and non-assisted population, especially to ensure the effectiveness of the methods that we have chosen, but also try to understand which could be the adjustment that needs to be based and needs to be done in order to reduce the error of the targeting method. But it's also important to monitor the process. So understand if there are some hiccups and some problems during the process of developing, development, also implementing the targeting. And it's important also to develop clear standard operating procedure that will define each single step to be taken and where things can be adjusted. Here it's a very clear example of monitoring of not really targeting, but it's a reduction of assistance due to resource constraints in Malawi. So we saw, specific outcome indicators, in this case the food consumption. So households with poor and borderline consumption, the assistance was reduced, and after the assistance was reduced. So you can have clear indicators and outcome indicators that are guiding the programmatic implication of implementing targeting or implementing prioritization exercise. And based on these results, then the targeting can be adjusted.